Healers Association in the SADC region, Dr. Sylvester Hlathi. Thanks so much indeed for joining us. In the main, what are the biggest concerns that some of your members, the traditional healers, have been bringing to you?
Thank you so much, and thank you for giving me this opportunity. The main concern of our members, the traditional healers in the continent, or especially in our province, even in the South Africa as a whole, is not the traditional healers. They are not completely well informed on how to protect themselves. Traditional healers, we don't have the equipment such as masks, such as gloves, such as anything that we can use. The concern that the traditional healers are raising is that they are not well informed exactly on how to see the symptoms of coronavirus, because that's the main problem. You remember, in most cases, our traditional practitioners, they are elder people. Some of them, they are not too educated. Some of them will live in a far rural areas in our villages. Those people need to be carefully informed and carefully educated and how to protect themselves first, and how also to diagnose, or how they can identify a person with the symptoms of a coronavirus. So that is the major problem. Because for now, you can see in most cases when our leaders in the province or even at the national level, when they talk about the coronavirus, they will mention churches, they will mention chiefs, tribal authorities, but they forget to mention traditional healers. And you must remember, we are the most important stakeholders in the society, because we live with the people here, we live with the young and old, and those people, they visit us on a daily basis. At the night, during the day, all the time we see different patients, different clients suffering from different diseases. So it would be much better if the traditional healers, they were well informed in coronavirus, so that we can assist the department and our government as well to fight this monster.
All right. Do you think that you have the medicine to be able to assist people with the COVID-19 coronavirus?
No, we don't. We don't have the medicine to assist on that. What we have our knowledge, indigenous knowledge, that you remember in those years back, 1830 something, there were some terrible diseases that in our continent, people suffered from. This similar is not exactly corona, that they would isolate a person in one small rendezvous, but those old ages, traditional healers, they used to have a special muti, special herb that they can use to protect themselves, not to contract the virus. Therefore, there is a muti that the traditional practitioners should use to wash their hands to protect the virus so that they're not infected. But we don't have any medicine for now to cure. What we need to do now is to educate our people how, because it's not all of them, they might know this plant. It's not all of them, they might understand which plant they should use. They can have that plant mixed with just a normal water, a warm water, or whatever, you can use that. But the traditional healer, they need to be well informed. Yeah. What is this plant? But you must remember that we as traditional practitioners, we don't have facilities such as money, such as a lot of things that we don't have, and all those sort of things. You need money to do that. You need money to have gloves. You need money to have a mask. But in this organization, we're trying our level best to buy masks, to buy gloves for our traditional practitioners. But yes, we do have something that people, they can use to wash their hands, but we need masks for them to cover their mouth. But yes, we do have something that they can wash their hands so that they cannot infect other people, and also to educate our traditional healers, our members, so that they must know that they must not stay in a group. Even if at your home, if you have a huge family, you must make sure that all of you are protected. So we need assistance from the government and the Department of Health especially.
You assisting the Department of Health where you do recognize those symptoms, that you are perhaps sending your patients through to the correct medical facilities?
Yes, we do that. We don't have a problem with that, because you remember we have been workshopped for some years ago in a different diseases such as TB, such as HIV and AIDS. So traditional practitioners, they know what they must do when they detect or when they see the symptoms. So we can refer our patient to a doctor, clinic, or even a hospital. But the challenge that we're still facing, we're still having as a traditional practitioners, it's no single day that any doctor or any clinic or any hospital, they can refer a patient to a traditional healer. That's the challenge that we're having. And you must remember, we have been helping people, healing people for centuries, for years. But when it comes to say, if a traditional healer has some herbs or some good plant that can assist in preventing or even in healing, the scientists, they will tell you they will have to do a research. That plant must go for 5 or 15 years through process of research. And while you are doing those research, it's fine, you can do that. But people will be dying on the other side. But a traditional healer, they've been healing or helping people for centuries using the similar plant. So why don't the Department of Health, our government, allow traditional healers, even if they're busy doing some tests through laboratory, etc., scientifically, it's fine. But okay, let's monitor a traditional practitioner who is healing a certain person who suffers from a certain diseases or certain sicknesses, so that you can monitor to see the patient is recovering or is not recovering, so you can advise the traditional healer. That will be much better, so that we can all work together. Not to say that you leave us behind. If you leave traditional healers behind, definitely you're missing a point, because if we don't know what we must do, the elder people, traditional practitioners in a village, in a rural area, they don't know what must do. Definitely we're missing a point here. People will end up being affected with this coronavirus, which we can protect. You must remember when the HIV pandemic came to our continent, some of the departments, they took very long to workshop traditional healers. But when they started workshop traditional healers, immediately the traditional healers understood the situation of a person who suffers from TB or HIV and AIDS. Then the HIV and AIDS never had a problem of killing our people. So we must do the same on the corona. We must not wait until it's too late. We must definitely ask the Department of Health, nationally, even provincial, to involve traditional practitioners. That will assist us in fighting this virus.
Dr. Sylvester Hlathi, thanks so much indeed for sharing your thoughts with us and your time on the program. All right.